In some women whose vaginal tissues are particularly sensitive to this, it can make the vagina less stretchy and less juicy. Hello, welcome back to Gyno Info, the podcast about women's health in normal everyday language that normal everyday people can understand. No medical words, no doctor speak. A special welcome to those who just discovered us and are listening for the first time. And before I forget, and you forget it as well, please take a moment to subscribe to Gyno Info. If you do not, then you might have a hard time getting back to this episode in case you have to interrupt in the middle of it and would like to get back to finish the podcast later on. You cannot count on the internet algorithm to send it to you in your feed anytime soon. This week, I'm again going to answer 3 of the questions that you, the listeners, have been writing to me at questions@gynoinfo.net, where you too can send in any questions you have as long as they have something to do with gynecology or women's health or medicine in general. When I don't know the answer offhand, I will always research it carefully and I will give it to you in a hopefully easily understandable form, not like the one in the medical textbooks and scientific articles that I studied to find your answer. Some questions I answer in one of these question and answer episodes. For some others, I need a whole podcast. But I will do my very best to get to all your questions. Please keep listening to them. Sometimes I also answer a question by one of my patients that I think you might find interesting. And now a notice about today's podcast right up front. This podcast does contain several slides. You might want to watch it on YouTube rather than listen to it wherever you usually listen to the podcasts, so you can get the most out of it. The first question is about the not very well-known side effect of birth control pills that many of my patients have asked about over the years. Do birth control pills cause vaginal dryness? The answer is yes. Some birth control pills definitely do tend to cause vaginal dryness and sometimes even pain with sex in some women, though most women don't notice a difference. I certainly never did, and I was on the pill for more than a dozen years. One possible reason for that dryness is that the artificial estrogen called ethinyl estradiol, which has been used in all classical birth control pills ever since birth control pills came on the market more than 70 years ago. This hormone does tend to lower the blood flow into the vaginal tissues. In some women whose vaginal tissues are particularly sensitive to this, it can make the vagina less stretchy and less. This feeling of being dry has a negative effect on libido, on desire, on sex drive as well. Why would a woman want to have sex when it's uncomfortable and even hurts? The ethinyl estradiol in birth control pills also causes testosterone to be trapped by proteins in the blood called sex hormone binding globulins. Testosterone also stimulates blood flow to the vagina and plays a role in sex drive, but only when it is free floating in the blood and not when it is trapped by these sex hormone binding globulins. Because of that, birth control pills can, again, only in some women, lower vaginal lubrication, wetness, and also sex drive. Fortunately, a newer birth control pill called Zoeli that contains natural estrogen rather than the artificial hormone called ethinyl estradiol has been available for about 15 years. I have used Zoeli successfully in many of my patients. Unfortunately, however, it is not available in the US and in Canada, but it is sold in Europe, the UK, Australia, South Africa, many Central and South American countries, and a handful of places in Asia. Women living in countries where these natural estrogen-containing pills are not available will just have to use lube. Actually, the next question I will answer will have to do with what kind of lubricants you should buy and what you should look for. Another option that many young women choose today and that gives them the same reliable birth control as do the birth control pills is switching to a copper IUD. These IUDs contain no hormones at all, and women will have their natural cycle with their own natural hormones. The drawbacks of copper IUDs is that they cause more cramps and more bleeding. You can learn all about copper IUDs in my podcast on them that I uploaded in October 2025. I would not recommend switching to hormonal IUDs, as the hormonal IUDs contain hormones that also cause vaginal dryness. But again, just like regular birth control pills, not for all women. I did a whole podcast on hormonal IUDs in October 2025 that I suggest you watch if you want to have more information. They have a lot of positive effects and are used for many other things, not just for birth control. Now, the so-called mini pills, pills that only contain progesterone, can also cause vaginal dryness in a few women, and I would not recommend that you switch to them if you have dryness with regular pills. But I want to stress again that I have nothing against birth control pills. In fact, I'm a big fan of birth control pills. I was part of only the second generation of women who had access to the pill, and it made all the difference in my life. When birth control pills were first approved around 1960, they gave women control over their own bodies and especially control over their fertility. Women no longer had to depend on a man being willing to use a condom and use it correctly. They freed women from having to be pregnant all the time. The pill saved countless women from having to stop their education to become mothers long before they were ready to have a child. And many women were so happy to be safe from those unwanted pregnancy and being able to say when and whether they wanted to have babies that their libido went through the roof, which is one of the many reasons controlling men felt threatened by the pill and have been telling lies about the dangers of the pill for decades ever since. The medical and scientifically proven truth is that birth control pills actually have many positive side effects, such as better skin, less cramps, less bleeding, protection from cancer of the ovaries and the uterus. The cancer risk is about cut in half by the pill, and also protection from infections in the tubes and endometriosis and cysts and other causes of infertility. But in some women with a blood clotting problem, or women who are massively overweight or really heavy smokers, they really do cause blood clots in the veins, and that is not a lie. And in women who are particularly sensitive, they can cause vaginal dryness and less sex drive. That is also true. But for most women, they're just perfect. The next question from a listener is a good match for the last question about vaginal dryness. And she asks, what should I look for when buying a lubricant? First of all, you may not even need a lubricant from a store. Often spit is enough to get you going. But if you choose to buy a lubricant, it is important to know that anything containing oils, whether those are plant-based oils like olive, lavender, or coconut oil, or artificial like Vaseline, petroleum jelly, or baby oil, all these oils can cause the latex condoms to fall apart. And that puts you at risk for sexually transmitted infections and in unintended pregnancies. Your normal bacteria in the vagina also do not like oily lubes. Using them destroys the normal bacteria and makes you more likely to get vaginal infections. So the word to look for when shopping for a lubricant or an intimate moisturizer, as they're sometimes also called, is water-based. That is much more important than the word natural, which generally is just a marketing word. So go for water-based. The last question has to do with a very common problem, not just for women. The listener asks, because of my hemorrhoids, I have a really difficult time cleaning myself after I have a bowel movement. Is there anything I can do? Yes, you can. I will give you some tips on cleaning yourself and also on what you could do if they don't work. Because you only mention a problem cleaning yourself and are not complaining about pain or severe itching, I am assuming that you are not really talking about hemorrhoids, but you're talking about anal skin tags. First, let me explain a few words that I will be using and also look at a few slides. The rectum is the part of the large bowel, and the anus is the opening of the large bowel to the outside. Hemorrhoids are varicose veins at or just above the anus. Varicose veins are dilated, widened veins, just like the ones in your legs. Hemorrhoids are divided into external and internal hemorrhoids. In the next slide, you can see a picture of what I mean by that, external and internal. Sometimes these hemorrhoids veins can get filled with blood clots and can even bleed. Then they tend to fall out through the anus, the opening of the bowel, to the outside, and they are very painful and inflamed, and you can see that on the picture in the next slide. After a while, the blood clots are absorbed and go away, but the stretched out skin stays behind like envelopes after the letter has been removed. And those leftover folds of skin are harmless and painless. They do not tend to grow any bigger, but they also do not disappear on their own. They just stay there. And if they're constantly inflamed, they can get thick and hard and bother you more. Sometimes skin folds or skin tags also form unrelated to hemorrhoids for other reasons, such as chronic irritation of the skin around the anus by overeager cleansing and scrubbing, or by tight underwear, or by overstretching of the anal skin during anal sex. Anal skin tags generally don't need any treatment, and they do not cause symptoms as a rule. But depending on how many you have and how big they are, they can be difficult to keep clean, as our listener has pointed out. And because this is an area where there are a lot of bacteria and pieces of poop can easily be trapped between the skin folds, they do need to be kept very clean. Otherwise, they get inflamed and start itching and burning and oozing. But it is very important not to use strong soaps or shower gels. These just irritate the skin and cause inflammation. You should also avoid scrubbing too much because that too is irritating. It irritates the delicate skin around the anus and causes even more skin tags. You should only wash gently with clean water or a super mild baby soap and then rinse it off thoroughly. If your anal skin tags do get inflamed, soaking them in warm water with chamomile or oak bark or witch hazel and using an anti-inflammatory cream can help. Anal skin tags are something that most people get over the years, and there is really nothing you could do to avoid them. It's not a matter of not being clean or anything like that. All you can do is manage them by keeping them clean and avoid irritating them with strong soaps or irritating them mechanically with tight underwear or thongs. If they are too big or too hard or otherwise too bothersome, they can be removed under local anesthesia in the doctor's office or in an outpatient clinic with an electrical knife. This will only take about 20 minutes, but you should plan on not going to work for 3 to 7 days to let them heal thoroughly. The other thing you should be careful about is not to just assume that you have anal skin tags. Have a doctor confirm it. Anal warts or anal cancer can look very similar to anal skin tags, as you can see in this slide here, especially if you have a lot of symptoms, which is unusual for regular old skin tags. Then you should see a doctor as soon as possible. Often even the doctor can not tell just from looking if what she sees is a harmless skin tag or a wart or a cancer. I certainly would not be able to see it from the slides that I just showed you. If your doctor is not sure, she will remove a tiny piece of tissue that's called doing a biopsy that will then be examined by a different specialist called a pathologist under the microscope in the lab. If it is a cancer, you'll want to know as early as possible so the treatment will be successful and you will need a lot less surgery than if you wait forever. And even warts like the ones in this slide that look pretty significant can just be lasered off. That definitely beats having them and doing nothing. But as always in medicine, you need to be sure of the diagnosis before you can treat anything. So please give your doctor the chance to examine you and make a diagnosis so that she can treat you. Don't be afraid or even ashamed to make an appointment. Your life might depend on it. Doctors are here to help, not to judge you. This brings us to the end of this episode. I hope you liked it, even if some of the pictures were quite gross, and it gave you a lot of information that is useful to you or someone you know. And if you have any further questions about this topic or anything else that has to do with women's health, please don't hesitate to send them to me at questions@gynoinfo.net. Again, that's questions@gynoinfo.net. And if you like this episode, please give us a lot of likes and share it around. Again, it also would be super nice if you could subscribe to Gyno Info. It helps Josh and me to keep this podcast going. Thank you. Until next time. Until next time, thank you for listening, and remember that you and your health are super important and deserve your full attention. Don't ever put off contacting your doctor because you're scared or embarrassed when something feels wrong about your body. Doctors are here to help you and not to judge you. And also, regular well-woman visits are always a good idea that you should make time for. You deserve it, and you owe it to yourself, and you owe it to your body and your health. This podcast is part of Pride House Media, hosted by me, Dr. Burki, produced and edited by Josh Rosenzweig. Original music composed by Nell Balaban. If you enjoyed this episode, please subscribe wherever you listen to podcasts. And while you're there, leave us a rating and a review. It really helps others discover the show. Stay connected and join the conversation by following me on Instagram and Facebook at GynoInfo and on LinkedIn at GynoInfo Podcast.